If you're just joining us, this is Good Morning Abuja on 98 Channel 5, the Unity Station. That was a feature on World Antibiotic Awareness. And we have a pharmacist in the house who will be throwing more light on the awareness. Please join us as we welcome pharmacist Sunday
Onoja. You're welcome to the program.
Thank you so much for joining us.
You're welcome.
Okay, so we are talking about World Antibiotic Awareness. And we have a week. This is the week. So throw more light on that.
Yes, World Antibiotics Day is a day that is set aside to educate members of the community for need of using rational use of antibiotics to prevent resistance. Because resistance is a global issue.
Yes.
Growing up, I used to know Ampiclos, very popular brand, very effective. But nowadays, Ampiclos is not effective because of the issue of resistance. So it is a week that is set aside to educate members of the community on the need of appropriate use of antibiotics to prevent resistance.
Yes. So is it because of the overuse? That is the resistance, is it because of overuse?
The resistance is as a result of misuse, indiscriminate
use of the antibiotics.
Okay, for instance, the doctor prescribes antibiotics for 5 days for you. You take for 3 days. Immediately you feel better, you discard it. So you are giving a chance for the bacteria to develop resistance. So subsequently, when you use such a particular antibiotic, it will not work or it might not work again because of the issue of resistance. That means it will increase the burden on the patient by cost. The patient will have to go for a higher molecule, and that will become more financial burden on the patient. But if you use the right dose at the right time, in the right duration of therapy, the issue of resistance will not even arise in the first place.
You know, this issue of resistance, that is all we are here to talk about it, because most of us are victims. They'll give you prescribed drugs from hospital. Once you're okay. Once they take it twice, some will not even take it. They'll throw it behind their, let me not. So now, how can this increased awareness help out in this matter?
Yes, the increased awareness is part of what we are doing here. The Clinical Pharmacists Association of Nigeria is doing that.
Okay.
We do that on social media platforms to educate members of the community to use antibiotics in the right way. I also come to understand that sometimes a patient will go to the hospital and be begging the doctor to prescribe antibiotics, whereas the doctor is in the best position to tell you that this is your clinical condition, it needs an antibiotics or not. So it is all the matter on us to keep campaigning, educating the masses for rational use of antibiotics.
So indirectly, saying all of us have gone to doctors.
All of us. When you have a similar symptoms for a long time, once it comes, you already know what's wrong with you. You just go and buy the drugs.
This is not my malaria. So this malaria has come again.
Has come again. They will not go for
once you use a particular antibiotics and you get relief of that particular bacterial infection, you are not supposed to save it for future use.
Wow.
You are supposed to discard it. Then when you have a need for antibiotics again, you meet your GP, your general practitioner, that's your medical doctor.
Because it may not be the same drug that you need to
use. Or a clinical pharmacist. He will now send you for a culture and sensitivity test to isolate the bacteria. After the bacteria is isolated, from the test, it will show the antibiotics that is more sensitive to the bacteria, and that particular antibiotics will be the one that will give you 100% cure rate.
Wow.
So when you do things like this, the issue of resistance will not even arise in the first place. Then another issue of resistance is self-medication. Somebody will
that was what I want to say, self-medication.
And go to the patent medicine store. The patent medicine dealer don't even have their license, does not even cover.
Sorry, I saw one 2 days ago. Malam, somebody came and said he wanted antibiotics. And the Malam outside at the bus stop just brought one. I don't know what he said to the man in the house. And the next thing he brought one cut, brought another one cut. I was just looking at them and saying,
that is misuse of drugs.
So the Pharmacists Council of Nigeria is working tirelessly to make sure such anomalies are resolved. It is not a one-day stuff. It's a gradual process that brings about the greater result.
No wonder you decide to make your awareness a 1 week.
A 1 week time. So that throughout the week, we are doing it. We are telling the masses, the community, the population that this is the right way to go about it.
Okay, anything we're doing in life, for us to get a maximum result, we have to be intentional about it. Now, what role can individual play? That is why we are here once again. What role can individual play to help the effective use of this antibiotic?
Yes, most of the individuals we are talking about are ignorant of the fact that there is resistance. So first of all, we have to break the chain of ignorance by campaigning, by telling them that is why a week like this is set aside to create more awareness, the dangers of resistance. And by doing so, the individuals will be aware that if I'm to use antibiotics, let me use it as prescribed by the doctor. Let me use it at the right dose. Let me use it at the right duration of therapy and the right frequency of dosing. Let me give you an example. A drug like amoxicillin, that's amoxicillin, the popular brand Amoxi. Now, amoxicillin is supposed to be dosed 500 milligram TDS. TDS simply means 3 times a day. That is 8 hourly.
Because
so at every 8 hourly, there's what we call peak plasma concentration. You are trying to get that base. So it's supposed to be taken every 8 hourly for 3 times a day for 5 days.
What if you miss the time?
If you miss the time, as soon as you remember, you have to just step in again.
Since it's within the 5 days.
Since within the 5 days, and you make sure. And the good thing is, before you even complete the treatment, you will feel good. You might feel good. So you can't discontinue it. You make sure that you finish the 5 days, and you see that the bacteria is completely eradicated. So the issue of resistance will not even arise.
So let's look at the responsibility of an individual who wants to use or who an antibiotic is prescribed to. What do you think the elementary things that person is supposed to know?
Now, that is what we mean. That's why it is very important to always visit a pharmacist. Because in the temple of drugs therapy, a pharmacist is the chief priest.
Wow.
He is the one that is saddled the responsibility.
Chief priest of the temple
of making the temple of drugs therapy. A pharmacist is the chief priest. When you see a pharmacist on issues concerning drugs, antibiotics,
qualified pharmacist.
All pharmacists are qualified. The Pharmacy Council of Nigeria is doing work to make sure that there are no quacks in the pharmacy discipline.
Or we have situations where somebody, maybe as a pharmacist, you have a brother who has stayed with you over time, and the person feels, okay, I know when somebody says, I have itching, and there's some drugs you prescribe, the person just goes somewhere and open up a shop.
Yes.
A pharmacy shop.
Now,
and start selling drugs.
Now, they give, there's what we call patent medicine vendors. They're giving them a license by the Pharmacy Council of Nigeria to operate. Pharmacy cannot be everywhere. Why they brought in that is because in those remote areas where there are no pharmacy, the people in that community need essential drugs. And these people are given this license to only sell essential drugs. Over the counter drugs. To cover the needs of the community.
Like
and antibiotics is not part of the balance. It's just those normal vitamin C, anti-malaria, paracetamol, all these normal ACTs.
Now that we are here, talk to us more on the ways that healthcare professionals contribute to antibiotic stewardship and awareness. Since we are talking about this on the professionals.
Yes, that is why, as I said before, when you see a professional, you are covered. From the professional point of view, before you can administer a medication, first of all, the intended therapeutic benefit must outweigh the risk. It is only in that condition that you administer a medication. So it is the work of we, the professionals, to make sure that we keep preaching the message to the populace by making sure that the right drug is given at the right time and in the right dosage of treatment.
Now we want you to You know, the issue of antibiotics is a serious matter.
It is. It has killed. It has killed so many.
When you take, somebody even told me once, he said, look, when they say take vitamin C, 2 tablets, because it's sweet,
people will go and take 4
your mouth,
and chew
the
it.
person say you don't know what you're doing to yourself. I was shocked. I thought vitamin C is something you just can take.
That is why Paracelsus, he made a very powerful call. He said all drugs are poisons, and all poisons are drugs. But what differentiates a poison from a remedy is the dosage.
Okay.
Dosing is very, very important in therapeutics.
Okay.
Once you start abusing drugs, that is where kidney failures, liver failures, all of this will start coming. Even paracetamol, if you overdose yourself,
any little thing people throw in paracetamol,
can cause what we call liver necrosis.
Wow.
Because it is the liver that metabolize some of these drugs. Or metabolize. So if you are abusing such drugs, you are endangering your health. And that is why we pharmacists are not sitting, we are not keeping quiet. We are preaching the gospel and we'll keep preaching the gospel until
it sinks into everybody's
mind.
So let's hear more of the do's and don'ts.
Let me start with the don'ts.
Okay.
Yes. On no account should you take any antibiotics without a doctor's or a pharmacist's prescription. That's number one. Okay. Number two, even if you are taking that antibiotics as prescribed by the doctor or the pharmacist, make sure you finish your dosage of treatment.
Okay.
Make sure as prescribed. Yeah. Even if you feel good in the course of the treatment,
make sure you finish.
Make sure you finish your dosage. And the regimen, the treatment, duration of treatment. Make sure you finish the duration of treatment. Then, sometimes a particular antibiotic you are prescribed for 5 days, but you are dispensed for maybe 7 days. When you finish the 5 days as prescribed, stop. Do not save the other one. Depending on when you fall sick
again and start from.
And do not share your antibiotics with another sister or brother.
Because the bacteria you attack let's buy one card and share.
Might be different from the one he or she is suffering from. So do not share antibiotics. And antibiotics are not meant to treat common flu and cold. They are not meant for that. They are meant for bacterial infection.
And also now that it's not good for you to take antibiotics without eating.
It depends on the antibiotics. But generally, we always advise you to have a meal before taking your medication.
I think since it's a week long of awareness, you should come back again, right, and talk to us, because it's like we have lots and lots of questions, but we don't have time.
I will always be here.
Okay, all right.
And this antibiotics abuse is
very serious.
Yes, it is. Thank you so much for your time with us on the program.